Welcome, everyone. I'm Tony Bernardo, Dean of UCLA Anderson, and I'm glad you could join us today. In this webinar, we're continuing an in-person discussion we held in late February on the coronavirus and its global impact. That was just 6 weeks ago, and it's remarkable how much has happened and how significantly the situation and the outlook have changed since then. A few things haven't changed, though. Among them is the importance of creating and organizing forums such as this to examine issues that are vital to our society and our economy. Clearly, nothing is more critical at this moment than gathering some of this great university's top experts to discuss the impact of the coronavirus. Today's panelists will address this crisis from a variety of perspectives: socioeconomic, business, and of course, public health. And we're very fortunate to have a distinguished group of panelists to hear from. I'd also like to say how much I appreciate the collaborations such as this one. Many of society's most challenging problems are by nature cross-disciplinary, so it's critical we work together with many of the extraordinary schools across campus. In that spirit, tonight's webinar was put together by UCLA Anderson Center for Global Management and UCLA's Fielding School of Public Health. Dean Ron Brookmeyer of the Fielding School is with us and would also like to say a few words. Ron?
Thank you, Dean Bernardo, and welcome everybody. The Fielding School of Public Health is thrilled to be collaborating on this event. Dean Bernardo, you and the Anderson School are great partners. And a special thank you to the Anderson Center for Global Management for all their efforts. And of course, thank you to our distinguished panelists. I look forward to this discussion, as well as opportunities for future initiatives between the Anderson School and the Fielding School. We have a global emergency, and it takes partnerships and collaborations to address it. We have both a public health and an economic emergency, and the culprit is the virus. And to address it, we need expertise that goes beyond any one discipline or subject matter. Inter-school events like this one bring critical expertise together. As the pandemic evolves, the data changes. Forecasts and projections are updated. And we need to be able to pivot as global data changes and as new information becomes available. Ongoing presentations, such as this one, help us do that. Help us separate out what is accurate from what is not, and help us make decisions when there is a lot of uncertainty, as there is today. I look forward to the discussion, and thank you again for joining us.
Thank you so much to both deans. For those of you who do not know me, my name is Sebastian Edwards. I'm a professor at Anderson, and I'm the faculty director for the Center for Global Management. And it is a great pleasure for me to be the moderator again in this panel where we're going to discuss the pandemic. We have two amazing panelists, Dr. Bob Kim-Farley and Professor Christine Law. And I will ask them to briefly tell us what they do, as we did the first time. But let me say a couple of words before, and it relates to what the two deans said. It was only 6 weeks ago that we met in person. And I remember asking Bob a question that drew laughter from the audience. I said, Bob, isn't it dangerous that we are all gathering here in a classroom discussing the coronavirus? Shouldn't we be away from each other? And I forget, sorry, Bob, I forget what you said, but I remember that it drew laughter. People thought that it was a funny question. And here we are just a few weeks later, maintaining social distance and having these events online. And that, of course, tells us how serious the problem is. So what we're going to do is I'm going to try to stay as nimble as possible and put the highlight on our two main speakers. I want to remind the audience that we have a system for asking questions, Slido, And all you have to do is type your question and we will get it. And it's very democratic. You get to vote if you like a question, and we will compile them. And I will ask most of the most popular questions. We'll see. I have to have some power being the moderator here. Okay, so what we're going to do, we're going to give Bob the floor first. He will make a short presentation. And don't forget, Bob, to tell us a little bit about your experience and so on, which is fascinating. And then we'll go to Professor Christine Law, and the same procedure. She was involved in dealing with the SARS epidemic in Hong Kong. So there's a lot of things that she can tell us that are very, very useful for what we're facing now. So, Bob, the floor is all yours.
Thank you very much, Sebastian. And really, it is a pleasure for me to be here again with you all, and many new faces out there as well, to further our discussion on COVID-19 and its impact through different lenses, as pointed out by Ron. I'm going to be talking about, if you will, the lens of public health and the impact that COVID-19 is playing in this. Sebastian asked me to speak briefly about my background. I started out electronic engineer, then went to master's in public health here at UCLA, then on to a medical degree at UC San Francisco, then on to the Centers for Disease Control and the Epidemic Intelligence Service. Stayed with the CDC for the next 20 odd years, 18 of which were on loan to the World Health Organization as the director of the Global Immunization Program in Geneva, as well as the head of WHO for India and for Indonesia. Then I came to United States back here and was a director of the Communicable Disease Control and Prevention Division of the Los Angeles County Department of Public Health. And just recently have now come over to UCLA as my full-time effort and teach course in Principles of Control of Infectious Diseases, as well as, interestingly enough, a Fiat Lux course right now, this time on COVID-19. So first time we're doing that one as well. So I just can echo the folks that have mentioned, what a difference the last 6 weeks has been. When we last talked, and I showed a graph to you, we had less than 100,000 cases in the world on the February 25th when we met, and we now are over 1 million cases. And I thought I would share with you just, again, what we are looking like there at the moment. So with this graph, you will see that we basically now, I'm going to have it played out, and so that you can see the full extent. Just realize that this is blocking my thing to show it. Okay, so you can see then, as we play this out, what's happened over this period of time. And really the amazing growth of this virus. I'll play it one more time in case you had blinked to see how this has changed. What I'd like now to take a look at is, if you will, a very nice dashboard that really indicates what the current situation is globally. The 1.4 million cases now, with some 81,000 deaths worldwide. Now approaching 300,000 cases that have now recovered. So I think that's, again, the little bit of light at the end of the tunnel that exists. If you look here then at United States, we have the 396,000 cases, 12,700 deaths. We have about 21,000 people now that have recovered. So again, with the hospitals being overloaded, and especially in New York City, we are beginning to see some discharges occurring there as well. Closer to home, if you look at what adheres in Los Angeles, we now have 6,900 cases and 169 deaths cumulative since the beginning of the pandemic hitting us here. So I wanted then to talk a little bit about the fact of the strategies that we currently are involved with to get a better understanding. We all started out, including China, with the idea of containment, and that means basically to be able to identify the cases, isolate them, get to the contacts, quarantine them so that in case they come down with disease, you still are stopping that outbreak. Well, the world, we didn't do too good of a job of containment, It is a very highly infectious disease. And so we have to then go to the next possible phase when we no longer are able to identify the sources of where the cases are occurring. That means there's community transmission occurring. We move to what we call mitigation. Now, mitigation is where we start using and employing some of these non-pharmaceutical interventions, we call them, such as at the personal level, covering the cough when you sneeze or cough, the idea of not shaking hands, using the namaste or other greetings that you may wish to use, the idea of 6-foot distancing, then it becomes important at the community level, and not avoiding going into any crowded areas. Most recently has been added the idea that even if you are asymptomatic, to be using a face covering when you're in public, close by anybody, ideally, again, staying 6 feet away from anyone. But that's the idea to prevent asymptomatic spread. You don't know you've got the disease, but in your own breathing or in your own speech, there may be droplets that are coming that could be infective to others. So this is a brand new strategy that's been put into place as part of this non-pharmaceutical interventions. Obviously, on the pharmaceutical side, we continue to work with the idea of developing medicines that may be efficacious, and the idea of vaccines ultimately, but those are going to be much longer, a year and a half still out to do that. I thought that I would give a little bit of an interesting insider viewpoint to a unique approach that's been done both in New York and in Los Angeles with the USNS Mercy and Comfort. These are very interesting ships, and I thought that I would share with you a little bit of an insider's viewpoint, because I had the pleasure of being on the Mercy out of San Diego. We went on a 2-day cruise of an orientation for people that were in Southern California that were involved with disaster preparedness and planning. So we actually went to see what were the capabilities. Obviously, you've got lifeboats like you see here, but the ship itself is actually 894 feet long. That's like 3 football fields. It is from a converted tanker, and its sister ship, the Comfort, is exactly the same. So what you're seeing here is exactly the same as the Comfort in New York. Interestingly enough, these 2 ships are the 3rd longest ships in the Navy. There are only 2 supercarriers that are longer than they are. So as we steamed out of San Diego and went to sea, like you have here, we were able to really start touring the boat and see what its capabilities are. So they have a huge helicopter landing pad, and these are hangars for 2 helicopters. These are high-speed rescue boats that are able to be used, especially in combat operations. The bow of the Mercy. And this is the bridge up here for where the captain is for controlling the Mercy. And then you start having some of the capabilities inside. This is a 1,000-bedded hospital on the sea, if you will. It's all self-contained. You've got intensive care rooms. You have operating rooms. By the way, there's 80 intensive care rooms. There are 12 operating rooms. These are the recovery rooms. You have also isolation rooms for, again, infectious diseases like COVID, but of course on this ship, you might end up with the whole thing being COVID patients. So the isolation no longer becomes quite as important. I might add, in fact, the original plan was not to have COVID patients on these 2 ships. New York is just changing over now to the idea that because their hospitals are so overwhelmed, they really need to have COVID patients being transferred. There was 2 reasons for that. One was that the ships actually wanted to keep their captain and crew and the nurses and doctors away from COVID-19, so that in case they ever had to be deployed combat operation, they would be readily deployable. But the Secretary of the Navy has made decisions that apparently they are now going to be able to take COVID-19 patients. Also, they're more set up, frankly, for combat operations for trauma as compared to treating just infectious diseases. Although one benefit of the crew that's on this is that they have extensive training on bioterrorism approaches, so that they are very trained staff to deal with infectious disease. They have a CT scanner. They have a fully equipped laboratory. And this is what's making up the rest of the 800 and some beds. As you see, it's not exactly a private room or a semi-private room. These are bunk beds for patients. So there are lots of patients to be handled under these circumstances. This is the control room. And you've got then some of the diesel engine. There's 2 of them on board for propulsion. And that's really a quick tour through the Mercy. I just thought you might enjoy seeing it, because a lot of times you're just not able to see the inside of this ship. So I want to now go ahead and come back to you, Sebastian, and we can move on to Christine.
Thank you so much, Bob. That was fascinating. A couple of very brief questions before we move to Christine. When was this visit on the Mercy? Was this
2007.
Pardon me?
2007.
2007. Oh, you look as young as you did then, so you're doing very well.
Thank you.
And so let me ask another question, which I think the answer is yes, but I'm a little surprised that they allowed you to take all these photos. I mean, did you have to ask? Did you have to sign something? I mean, how did that?
No, they didn't seem, you know, since it's not, I guess, a warship, that's one of the reasons. I didn't share with you photos that had other people in them. Just I thought that would be better not to, but you didn't have the permissions. But no, there was no one seeming to have any problem with us taking photos.
Okay, fantastic. Thank you so much, Bob. We're looking forward to your second round. So let me now move to Professor Christine Lo, who has been teaching a fantastic course on the interaction between public and private policies and aims and ESG and a number of very, very important issues. And as I mentioned, she was involved working in a very high position in Hong Kong in the effort to defeat the SARS epidemic a few years back. So Christine, thanks again for joining us in this follow-up for our panel. And please take the floor.
Well, thank you very much. And it's great to be able to collaborate again with the 2 schools. Let me just say a little bit about my involvement with SARS in 2003 and 2004 in Hong Kong. Actually, at that time, I was running a public policy think tank. And for about 4 to 5 months in Hong Kong, it was like a ghost town. And, you know, obviously the economy has collapsed. People were extremely fearful. We had tremendous pressure on our public health and hospital system. So at that time, since I was running a think tank, the most important thing for us was what contribution could we make? And we decided to document and to understand the issue. And one of the university's publishing houses invited us to publish, you know, to co-write and publish very quickly. So I put a group of people together, a terrific team of interdisciplinary, multidisciplinary team who could, you know, cover everything from the health to the economy to the social aspects to the public policy aspects. So we put out a book in 2004 on SARS, and I guess that's my continuing interest to COVID-19 today. I have a number of observations. You know, we talked about, well, it was only a few weeks ago, and look how life has changed. But of course, even 6 weeks ago, we knew of where the story started. The story started in a major city in China called Wuhan, and then the province is Hubei. And at that time, I think the world was kind of staring at China and sort of saying, oh, well, you know, it's kind of happening in Asia somewhere. And there was this sense of disconnectedness. But I think today we know that actually we're living in parallel universes. The pandemic, it's pan because it affects all of us. And each community, or maybe we could say each country, we're kind of living in each other's parallel universe. But what it is there are some countries that went first. So the epicenter was in China. And from there, it moved on to its closest neighbors in Asia. And we started to witness how the earliest, the places that were closest to the epicenter, that was essentially Greater China. So you had Hong Kong, Macau, Taiwan. And when they got the sense that there was a virus around, and they remember SARS, their action was all relatively quick to see how they could contain it. So they started border checks, they canceled events, they closed schools, and everybody was sort of wearing masks again. So you could say that was the early phase, the outflow outside the epicenter of Wuhan. And then it got to Iran, India, Japan, South Korea, Singapore. And then of course it came to Europe, and then the epicenter became European countries. And then now you could say maybe the next major epicenter is New York. And I think it was only yesterday or today, it's kind of gone backwards into Japan, because for all this time, Japan said they didn't have much of a problem, but then we now also know that they didn't do much testing. So I think this kind of going around nature of a pandemic, the question that I have is, who is learning what from this experience? Because you're seeing the earlier ones, they're doing whatever they're doing, the later ones, what have you learned? And then if you're now looking back at Hong Kong and Singapore, and including China, they're looking at how to prevent a resurgence because people travel. For example, in my hometown in Hong Kong, a lot of people actually left Hong Kong to come to the United States, go elsewhere because of the virus. And when things got worse in Europe and America and things got better in Hong Kong, they started to return home to Hong Kong. And I think you have the same thing with Singapore. So people coming back has brought back the virus. So in a way, you're kind of seeing the whole cycle now. The question that I think is very, very important is, that's why people are talking about cooperation, global cooperation. But we haven't quite got it right now, especially with US and China being the two major economies, the two very capable, you could say very capable countries. But the cooperation is not that good. So that's my first point. My second point is, we've all been observing the leadership and governance quotient of different jurisdictions. And of course, right now in America, we're talking about, well, the problems of states versus federal government. But actually, when you go and look at different countries, and I won't go into any details at this moment, how governments deal with this depends on, I think, a number of factors we're beginning to observe. So for those countries that went full into it right from the beginning, what were they doing? So we said in China that their problem was they had a 2 to 3 weeks lag of not escalating the issue. But once they did, it was draconian. Now, when you're that draconian, what was your priority? Well, they obviously needed to save lives. That was what it was about. Because if they didn't save lives, they wouldn't have an economy. So that was their decision, to be draconian. As you move to other places, there's also this discussion about, well, the economy. And this is still a discussion here in the United States. How do you not kill the economy as you're trying to deal with the virus? Another issue that comes up is the readiness of your public health system. Did they have all the, are they ready, to deal with testing and tracing and isolation? Or did they miss a window? So people now are talking about different countries. They definitely had time, but they also miss various windows. So that's my second point. This notion of leadership and governance. But actually, it's quite difficult for politicians when something new is happening. How do you decide, first of all, how do you not overreact? How do you not underreact? And what is the appropriate reaction? Now, the thing is, I think because it is a pandemic And we are seeing it in going about. You would like to think that those in the latter part of what's happening have observed enough of what's happening elsewhere to be able to act much more decidedly. So that's my second point. My last point at this stage is actually what COVID-19 is doing is it's flushed out all these issues that so many countries have been arguing and talking about. I mean, for example, issues dealing with public or private health. How is it that in certain circumstances, the public system is not able to deal with a pandemic? People talk about the role of the government. People talk about supply chains. That's another major issue. People talk about social equity. When you have a pandemic, who are the people who are truly vulnerable? Now, of course, it hits everybody, but you know, if you're a migrant worker, in many countries, not just in the United States, in some countries, asylum seekers, obviously low-income families, you know, people who are truly vulnerable. And we're watching horror scenes in countries like India. So you know, all this assemblage of social equity issues is also now front and center. Another one is, of course, the environment. We're seeing at the same time, because we've all slowed down, how the environment has dramatically improved in so many places. The issue about wildlife, illegal trade of wildlife. And I think lastly, I'll just mention that governments are now coming forward with enormous economic packages. And who are you giving the money to, and how are you giving money to the people who most need it? Actually, not many governments are doing so well at the moment. They've sort of say, here's billions and trillions of dollars, but who are the people who need it tomorrow? Because actually the day after, they might not be able to have the next meal. So I think all of these things, the social economic issues in many, many, many societies are playing out. So thank you.
Thank you so much, Christine. That was wonderful. And you raised a number of very important issues, some that we discussed a little bit, not in enough depth during our first meeting, like the inequality issue. And I remember that we discussed, for instance, what would be the effect of the then emerging pandemic on the countries of Africa. And we talked about Lagos in Nigeria, very crowded cities. We've seen photos now of which remind us how crowded and how weak is the public transportation system in the subcontinent and in Africa, where people get on trains and they have, I mean, it's like going into the Tokyo subway during rush hour. So let me just then ask Bob for his second short presentation, and then we'll open up for the questions and answers. Bob, anything you want to say? Any reaction that you may or may not have with respect to what Christine said? I have two questions that have been sort of percolating with the two courses I'm teaching on the pandemic. One is the way we present the data. And one of the graphs that people really like is the one that has the epidemiology curve. And we see the countries on the uprise, and then we've seen that China is going down and it has peaked. And but those data are done in absolute terms, number of dead people, irrespective of the size of the country. And a lot of students have asked, why do we do it that way? And there has to be an answer to that question that will come from you. And the second question is, why aren't we doing, or at least not massively, random testing? Why aren't we getting random samples of, I don't know, 700 representative sample of the city of Los Angeles by demographics and gender and age, and then test all of them and then get sort of a base number? Why isn't that being done? So Bob, please take the floor.
Thank you very much, Sebastian. In terms of, Christine brought up a number of good points, a couple that I just thought I'd react with. She talked about the need for leadership and especially for public health. I think it is important to realize and how much we really have underfunded public health in this country, and the need really to have a robust public health system. And I think the pandemic is bringing out exactly some of those issues. For example, after 9/11, there were billions of dollars put into public health at national, state, and local levels. Health departments were using this to develop support, preparedness plans, caches of supplies. And just for example, in California alone, if you look at it, there were hundreds of millions of dollars put into developing a cache of supplies, masks, the very things that we need now, field hospitals. But in 2008, 2009, with the recession, basically they looked at that and said, well, it's costing $5.8 million a year to maintain it because you have to make sure the ventilators are still working and things like this. And they basically gave away or sold off all the equipment. And so it was never replenished when we had good times. So that's one of the, if you will, issues that's happened at all levels, national strategic stockpile as well. So I think that that's one of the lessons hopefully being learned, is that we really can't just, hope that a pandemic doesn't happen. We need to always be preparing for that and have that in place. I think also this issue of, Christine, you mentioned about killing the economy off, and we'll leave it up to you economists to talk more about it. But I think one of the things that really bothers me and is concerning to me, especially, is in the developing countries where the populations are so vulnerable, that basically here we're telling people, stay home, don't go out unless it's essential. And, even though it may not be reaching everybody, there are trillions in the pipeline. Hopefully we can make sure that that does get to the people who need it most. But something like that's just not going to happen in Nigeria. There is no social safety net that can begin to handle this. And you can't, it'll be very hard to tell people stay home when if they stay home, they're not going to eat. So that's going to be a very, very difficult situation. And I think, again, that points to the need for global solidarity in this. I mean, it's going to maybe take some of the developing world support from the developed world to help handle economically through this as well for the most vulnerable of populations. Sebastian, your 2 points. One is, I'll take the first one, your random testing and why isn't that being done? You are entirely correct. We really are still floating a bit blind epidemiologically here. We need to have random testing that basically is like the pulse, if you will, of the community to know what is the penetration now of asymptomatic infections? Where are the diseases occurring, so that we really can know. Right now, we're saying that, gee, if you had mild symptoms, don't even come to the testing because we couldn't test them. That's beginning to change here in Los Angeles. More tests are becoming available. But you are entirely correct. We need to do what we call surveillance testing to be able to have a real good understanding of what's happening in the community at large. The other thing on the epi curve, I thought I would just share with you this issue of what, we keep talking about the curve. I wanted to make sure that people had a good understanding. Obviously, the epi curve is, if you will, an epidemic curve. It shows the progression of the disease over time. And it's important because it allows us to track at which point we are in an outbreak that we're currently experiencing. So the whole idea now, of course, is to be able to flatten the curve. And by that, we mean you've got this animation, I think it's showing exactly the situation. So without doing anything, we would have a very steep rise. We would have it overcoming the healthcare system's capacity, like what happened in Wuhan, China, and parts of Hubei, and is almost at the brink of happening here in New York. And so if we can practice these things, like people with mild symptoms staying at home, so they're not hitting the healthcare system, contacting the healthcare provider if you have symptoms before going to the hospital, making sure you're also keeping the hospital aware when you're coming in so that they're making proper precautions. And these whole issue of practicing the physical distancing measures, keeping that 6-foot distance from others, staying away from crowded places, will all help to flatten this curve. And that way we don't overstress the healthcare system. I have to point out to you that, of course, one observation that you probably see here is if you had the sharp curve, you have a lot of pain, a lot of misery, but pretty soon everybody gets infected and dies out because you, quote, burned out the epidemic because everybody has become immune. If you flatten the curve, you are extending much less misery, but for a longer period of time before you start getting on the downswing of this curve. So that's one of the issues that happens, but it's much worse to have gone ahead and stressed our healthcare system. So I thought that would be a nice couple of points to mention in our second round here. And then of course, things that will be of importance to those that are viewing today.
Bob, thank you. That's fantastic. I have to follow up on your great animation on the curve. Again, questions that have come up in the course and the two courses I'm teaching. In your picture, it seemed to me that the area under both curves were roughly the same. So you're not reducing by taking the undertaking the containment policies. You're not reducing the number. You're just sort of distributing across time in a different way. So is that necessarily the case? I mean, do you epidemiologists believe that generally the two areas are going to be the same? Or does the containment also reduce the number so the area under the flattened curve is a little smaller? That's number one. And the second question is related to the final point that you made, which is that if you flatten the curve, the bug lingers longer among us. Does that increase the probability of a second round, or is the probability of a second outbreak independent of whether we flatten the curve or not?
Very astute questions, both of them. So in the particular simplified graph I was showing, yes, the area under the curve is really the same. It's just that it's been spread out. And in that sense, it's kind of a mitigation. You're just trying to keep it down. Now, what we are hoping in this outbreak is that, in a sense, you can look at what China ultimately did, which was beyond just mitigation, going to suppression, bringing it actually back down to zero. And if you can do that, you might be able then to go back to a containment strategy. So if you went ahead and you've basically only having imported cases now occurring, and you have the ability with lots of testing available now to be able to test people, to be able to find and identify any cases, again, to quarantine people around them that have had close contact, you could continue to make it so that this does not flare up and have a big second wave. The other thing you do is by flattening the curve, you quote, buy time. And in this time, there's two things that I think will be helpful to us. Number one is that we are going to get good medications that will be effective, so that if someone does come in with more milder symptoms, we may be able to treat early on so that they actually don't go on to severe symptoms. So that's one thing that will be helpful. It still means that they're infected, but it's not going to have the consequence of severe disease, needing intensive care units and death. The other thing that we're buying time on, even though it's still probably a year to a year and a half out, is the development of vaccine. So if you can develop the vaccine also, that area under the curve then will become different with the flattened one, because you're now able to protect people that will not have to have disease. So that's some of the things that would come into that feature that you've asked about.
Thank you so much, Bob. That was fantastic. Christine, back to you. Let me ask you, Christine, let me ask you a question on the leadership issue, which it's, I think, a very relevant one. No one in any country, as far as I know, maybe there are countries that I haven't been paying attention to, but I don't see we have seen a figure, a man or a woman who has come up and lead the process and provide comfort and be someone that people look up to, and that is playing the role of leadership that you mentioned. And as I think back to other disasters, not necessarily pandemics, I go back to the 1927 Mississippi flood in this country. And Herbert Hoover was the Secretary of Commerce, and he took over. And he had already worked in the relief of the Belgian and the northern French areas after World War I. But he became associated with the notion that there is someone who is very efficient, an engineer, who can solve this problem and move us forward. And that's how he ended up being president. Do you think that the absence of these figures is because of the times, because there is now social media, because it's more difficult? Is there any explanation why in the past figures sort of emerged sort of in a way that people didn't expect, and now we don't see that? Why do you think that that's the case?
I agree with you, Sebastian, that it may be that we haven't focused enough on leaders. I mean, they're not necessarily all national leaders. They could be local and regional leaders. And, you know, Macau is a very, very small place, but it is the Las Vegas of Asia. They've done relatively well. And they've, you know, but some of the things that they did right from the beginning, well, you could see other leaders hesitated, you know, so right from the beginning, they decided to border checks and, you know, close this and close that. And okay, they're a gambling town where I think a large number of their workers are in the casinos. So what did they do, right? You know, so after they closed down for a while, they started to look at how to make things work. They kind of did physical distancing in the casinos. They closed schools, right? So what I'm saying is they did many, many things. And today they don't have any cases. Now, the other thing that I think is interesting is in Portugal, okay, they have quite a number of cases, but one of the things that they did was they've decided that during the pandemic period, all migrant workers and asylum seekers will have the same rights as nationals. So that was a pretty spunky decision, because what it means is the people who are there that don't have rights to the social and health services are able to be treated, and they don't have to worry about it. So what I'm saying is, I think there are pockets of leadership here and there. And what we perceive is very often maybe what the media tells us is there. We're focusing a lot on the disaster, not necessarily perhaps in places that people have done well. So I can't quite fully answer your question, but I think some of those, the leadership, the more inspirational things, I think they're there.
Thank you so much, Christine. So one of the questions that has received the most votes, it's an issue that we've touched on, but I would like to maybe hear your views in a little more depth. And that is, and again, we'll switch back to Bob and then go back to Christine. How do you see the health system evolving? I think that the question, although it doesn't say in the written question, refers mostly to the US, Bob. But also let's talk about it first the US and then maybe globally. I think that an interesting feature here is that the World Health Organization ranks the quality of the different public health systems. And Italy was ranked, I think, in the very top 5. And we can see that it totally collapsed. So can we trust those rankings? Are there dimensions that the experts at the World Health Organization were not looking at? So how will things evolve? I mean, 5 years from now, when we describe the health system, are there going to be features of it that we're going to say this came about because of the 2020 pandemic?
Very good question. I also just wanted to respond first on Christine. You talked about, again, you know, sometimes the dearth of leadership. I think a good leader that we've seen here in the United States has been Dr. Tony Fauci. I'm sure many of you have seen him, but here's a public health leader, basically, that is telling the American people, you know, what the facts are in a calm manner, and preparing people what they can do for themselves and for their loved ones. That to me is some of the, he's got a lot of the characteristics of a leader. And I think that's something that, again, we can try to emulate in our own efforts. I think also this issue of the healthcare system, I think really in public health, we really feel that, access to health care is a right and not a privilege. And I think that this current situation is really, if you will, laying bare the holes that we have in our healthcare system for people. And so I'm hopeful that maybe one of the longer term effects that could come out of this is a recognition that, look, there are problems in our healthcare system that do affect the most vulnerable in our communities, and we have to solve them. And probably things like at least having single payer options are one of the ways in which we will ultimately go about doing that, so that we make sure that every person here has access to affordable health care. I think also I just wanted to mention, by the way, that since some of you seem to like the flattening the curve, that was actually done by my graduate student, Yusuf Arif, who's doing independent studies with me right now on COVID-19. So it's kind of a nice way to have him seeing his work also being displayed.
Great, Bob, that you give credit to your students. We should do that all the time. Before moving to Christine, let me ask you a question that just came in, which is the controversial approach followed in Sweden. The first thing I did this morning was look at the graph, and they highlighted Sweden and Norway. And Norway is doing much better in the sense of having fewer deaths, but probably it's too simplistic to just compare to neighboring countries. But tell us a little bit about Sweden, which is, I think, unique in its approach. How do you see that?
Well, first of all, I'm not as familiar with exactly what they're doing in Sweden. I do have, if you will, a quick look at what Sweden looks like. They've had 7,600 cases, 591 deaths. But did you have a particular element that you had found out that they were doing that you thought was unique?
Well, yes, they did not close the schools. They did not close the bars. They did not close the restaurants. So you can go and have a drink with your friends. Universities and higher education are closed, but grade schools and I think up to junior high continue to be open. So,
well, we shall see. If that I would be very askance that strategy is going to serve them well in the long run. I mean, they're probably a little bit more isolated from some of the other countries in Europe. But I mean, if you've got 7,000 cases and 600 deaths, shall we say, I wouldn't be very surprised if we don't see a more robust, if you will, upswing coming up. You see over here, in fact, this is what their graph looks like. To me, that doesn't look very promising that what they're doing is being very helpful. So
can you put Norway very quickly, and then we'll move to Christine?
Yeah, let me just see if
Norway is just two below Sweden.
I'm sorry, I didn't notice that. Okay, thanking you. Yeah, so they also are still on an upswing, maybe slightly tapered off. But I think that no one is going to be able to escape some of these physical distancing measures and be able to expect that they're not going to have problems. The only thing is that, again, if you've got really robust testing and you can actually implement a containment strategy, because you're really checking people coming in, you're seeing that they whether they have any virus, you're isolating them if they do, you're making sure any close contacts are being quarantined. It would be possible to do a containment strategy and not have to go to a mitigation strategy. But it takes a really robust system at this stage because it's so infectious.
Thank you very much, Bob. I must say that I agree with one of the participants here who wrote that the Prime Minister of New Zealand, Jacinda Ardern, is playing a very important leadership role in her country. And I think that increasingly she's being looked at as a leader in the international in the international arena. Christine?
Yes, I think the case of Sweden is interesting. And I think people, for example, in the United States are interested in the Swedish case because it seems to be able to deal with less economic damage. But however, I agree with Bob. I think the judgment is still out there. And also, I believe in Sweden itself, this strategy that they have adopted is controversial. You know, so it's being debated in Sweden. So we wish them well, of course. So let's see. When I was talking about examples of leadership, I guess I was focusing on political leaders, and I definitely agree. Dr. Fauci, and in fact, in China, in Hong Kong, in different places, there have been leaders in the public health sector who has been extraordinarily important to be able to speak with credibility to the governments, to in a way guide them to do the best thing possible. So I think that there is another issue here of how closely, when you have a pandemic, how closely governments work with their public health experts. But the decisions of when you do what you select to do and not to do are generally the responsibilities of political leaders. And we are seeing a diversity of choices from political leaders that are leading to different results. So the delay in making certain decisions, or you could go back in time and say, well, actually, the experts have been saying to countries and to the world at large that a pandemic is around the corner. And this is a national security issue. This is a public health issue. And now I think it's been brought, full frontal to us that this is a huge economic issue if you don't catch it early on. So I think the political accountability issue is very, very important. How people are going to judge their political leaders, as we go along. I was going to say when COVID-19 is over, but I think it could be running in the world for quite a long time.
And also, Sebastian, I was quickly doing a little homework in class, so to speak. This was very interesting just from yesterday. It's talking about a recent article in The Guardian pointed out that the Swedish government is now in the process of developing extraordinary legislation to deal with the growing threat posed by COVID-19. And noting that, again, that in Sweden, the death toll is nearing 500. We already saw it's 591, significantly higher than some of its Nordic neighbors who adopted a more hands-on approach to fighting the virus. Norway was the one you asked about, has only tallied the 76 COVID-19 deaths, perhaps because they went all in with early prevention efforts, including closing schools, banning cultural events, and even prohibiting, quote, cabin holidays. So I think that might be, again, helpful for us to see that.
Right, yeah, so they are, I mean, I think that Boris Johnson's situation where he became, after defying the received wisdom and becoming very ill himself, I think that that's meaning that countries can revise, that Swedes are revising their approach. So let me try to go back to, so Bob is an epidemiologist and Christine is a political leader and a lawyer. So none of you is an economist, but I want to get to the economy and get your views on it. And both of you have talked about solidarity and in particular what this means for the poor countries. So I want to provide a little bit of background here. The fiscal package in the United States is about 10% of GDP. So the total output of the US is about a little over 20 trillion. The package is 2 trillion and Congress is already talking about a second package of maybe $500 billion. So we're talking about between 10 and 12% of GDP maybe even 20. So we're talking about 17, 18 trillion dollars in the world economy. For non-economists, it's very difficult to understand that number. It's just a lot of zeros. Right? I get confused with all those zeros. But there's no way in the world that that the 90% of the emerging and developing countries can issue debt anywhere similar or close to what they need in order to put in place these packages. There are people calling for a Marshall Plan. I think that it's an illusion, that nothing of the sort will happen. I think that the world has moved in a way, and the politics of populism are such that the rich countries are going to be very stingy. Do you have a view on this? And if this stinginess actually does take place, what do you think the consequences may be? Both from a public health perspective and from a political perspective. So I think I'm saying epidemiology, Bob, politics, Christine, but choose whatever you want to address here. There are questions, some of the questions in the slide were about these issues.
Well, one thing I always think about, again, the idea of really, we're all one family here on this planet Earth, and that we really have to recognize the interdependence that now exists. And I think I gave maybe analogy before, but the analogy of the body, that you've got the brain, you've got all the other parts, you've got a toe, but if the toe, let's say, gets a infection going on, the brain can't say, well, look, that doesn't really bother me, it's just the toe, because that could be seeding a septicemia that ultimately takes out the body, brain, and all. So I think we need to recognize we are interdependent, and if someone is suffering in one area of the world, it could be virus, anything like that, that could ultimately come back and haunt us as well. So I think just out of self-interest, we also really need to reach out and support the developing world to make it safe, so that, again, they are not exporting disease to us as well. If you just want to look at it from a self-centered viewpoint, but I really think there's also an altruistic humanitarian viewpoint too, of making sure that those who have also share what they have with others in a humanitarian gesture.
Thank you, Bob. It's so complicated, Christine, because you mentioned Portugal, and there's no way Portugal can float bonds and issue them and place them at a reasonable rate, nor will it happen with Spain. So now finally the Germans, and this gives us a little hope for solidarity, at least within that group, the Germans are finally maybe going to agree that a Eurozone bond will issue, which basically means that the collateral is given by the Germans, but the proceeds are going to be shared with the other countries. So it's the very poor countries in the world, the Burkina Fasos, the Ethiopias, but also countries like Portugal or Greece. Christine, what do you think if stinginess, I think that Bob was very clear that we should not be stingy, we should be very much following a solidarity approach. But if that does not happen, Christine, how do you see this evolving? I mean, riots, looting, tell us how you view this.
Well, my own sense is, I think if you were a local, if you're a national leader of a developing country, and you're seeing the disaster that is being rolled out, and it's not just a public health issue, it's just not that people are going to be infected or they're going to die, is that the economy has collapsed, and the income earner has perhaps died. There is a social disaster going on. So the question, if you're such a leader, is what can you do to alleviate the situation? So domestically, you've got to pull everybody together. So you can pull people together when the country is not so politically divided. You can actually, if a country is able to pull together and work on their local resources, that must be the first step. And they also know in developing economies that they cannot do everything by themselves. And you gave the example of Europe, and because in Europe itself, in the European Union, there are richer countries and there are poorer countries. If they, as an agreed political and economic unit, cannot come up with a short and longer term plan, then that spells very bad for other places. Now then, on a global basis, again, as you were alluding to, you could have mass migration. You could have, as you say, social instability. So none of this is good for neighboring countries. None of this is good internally. So countries have to be able to say, it is not me first. Countries have to be able to say, actually, this pandemic is having such a huge impact on everything that we're doing, that perhaps at this time, we need to see how to help individual economies to kind of get going, but all the countries need to come together. So you've had the G7, well, they didn't manage to do very much. You have the G20 that met, maybe 10 days ago in late March, and they said, yes, we must cooperate. And then you have US, China still fighting. So I think the world needs to, or the politicians of these major countries, especially the ones with resources, they've got to come forward and say, we don't want this to happen because it's bad for many, many things. It's bad for our national security, for example. It's bad for the economy of the world, that they will then be driven to actually sit down and discuss shorter and longer term plans. But the initial plan have got to come from the local authorities, because they're the ones who can get hold of some cash and actually get it to, and think of ways to get it into the hands of families who will not be able to have the next meal.
Also, mention one thing too, following what Christian mentioned. One was this issue of, like, Spain was talking about. If you look at the U.S. with 12,800 deaths, if you check Spain out, 14,000 deaths. They actually have more deaths now than we do, but they're only claiming 141,000 cases, where we're at the 390,000, I'm sorry. So that basically you can figure that, 30 times what the number is. So they should be way over now what the US is in terms of numbers of cases, just a matter of the testing not being done. And the second thing I wanted to mention, because we've been talking about the developing world, you can see how little is being reported so far from Africa, and yet you just know that once this is in these cities like Lagos we talked about, it's going to be an explosive outbreak.
Thank you so much, Bob. That's and Christine. That is great, and both of your answers confirms what I knew already, that both of you have big hearts and you are you favor solidarity. And I hope that you are right and that the world leaders listen to you. I am, as I said, on the pessimistic side of things. So before moving to something else, let me do a little bit of advertisement here. If these countries cannot, if the poor countries or any country cannot raise money by issuing bonds, COVID bonds or solidarity bonds or something along those lines, and the World Bank and the International Monetary Fund don't have enough resources, there is also always the option of what economists call helicopter money. And helicopter money is that the central bank in our country, the Federal Reserve, just prints money and drops it into people's backyards using a helicopter. And that is, of course, a very, it's always available, although there are lots of legal constraints. But anyway, the advertisement is that I will be giving one of these talks towards the end of the quarter of this series of talks on helicopter money. And what does it mean? What the options are? It's sort of like a nuclear option for these countries, which is, let's just print money and give it to the people freely. So we're going to have that further further in the future.
You can always have the helicopter drop by my place then.
Yeah. We're going to send it first to you and then to Christine. In that order, I think. We're going to maintain this order that we've had today. And then it will come to my house, huh? So let me ask you, do you think that there are going to be lasting behavioral changes in the world? So let me just try to add, to put this in a sort of a light, from a light perspective. The French and other Europeans used to greet each other or women with 3 kisses. Okay, on both cheeks, and then you repeat the 3rd cheek. Is there going to be a change, like we're going to go to 2 kisses only, or 1, or maybe just waving? I mean, and any kind of, do you think that or is memory short, and 5 years from now we will sort of remember, but we'll be back to being in crowded spaces and sneezing on top of people and all of those awful things? What do you think will happen?
I think one thing is that, behavior is one of the hardest things to change, especially, rooted in cultural practices. But, they say that if you've been doing something for 3 weeks, that helps to create a habit. So I wouldn't hazard a guess for all of them, but I think things like, for example, washing one's hands, I think that may actually be something that sticks. So that, we may see patchiness in terms of behavioral change in this.
Christine?
You're muted.
Sorry, I think people might rethink also some things like buffets. I think the public aspect of how businesses interact with people, perhaps we now know, because of the travel pattern of people, aircrafts is a tremendous carrier of diseases. So what have you got to do to redesign the travel experience and the aircraft itself to make it less, less infectious, so to speak? So I think we are going to see many pockets of changes in terms of, our own cultural behavior. I think similar to Bob. Perhaps I can just mention one thing that I think would be really important. Because right now, the whole world, including us here in Los Angeles, we're being asked to only maintain essential services. And companies are saying to their workers, we're rethinking who can work from home and who still needs to be kind of out there. But we don't actually have a very clear definition yet of what essential services are and what are essential workers in a particular industry. So, I mean, all of us are using so much of the internet right now. We actually, the people who are providing those services, we need them, right, to keep everything going. So if you were running a computer company, what is the proportion of people in your sector that you need to keep going so that, I mean, they can't just stay at home. That's what I'm saying. They need to go and maintain certain services to be able to serve your customer. So what I'm saying is every industry probably should be thinking about that. And that would be a good thing.
That's a great point.
One thing to mention on that too is, in my mind, because you're mentioning the internet, if this was 20 years earlier, we wouldn't have any of these types of meetings we're just having right now. And I think that maybe businesses are recognizing, gee, was that business travel really necessary? I actually could have probably done it over Zoom. And the issue of the telecommute worker, gee, that person's still very effective where they're doing now. Maybe I should be more relaxed in my policies. And then that will cut down on commuting, which will help reduce air pollution. There could be a lot of spin-offs that could have some positivity to this.
Yeah, so that's very interesting. In tomorrow's Financial Times, there is an article, and I think it's very interesting. 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 on an estimate on what fraction of the jobs in different countries can be performed through the internet. And it varies from country to country. And not surprisingly, in Europe, this is on Europe, the two countries with the largest manufacturing sectors, which are Germany and Italy, are the ones that have the fewest jobs that can be performed from the distance. Mm-hmm. Now, in this country, this is something that I discussed with my class on the COVID-19. In the US, only 12% of jobs are related to making things, producing things. Manufacturing is 8%, and then we have construction about 3%, and then we have mining 0.5%. This is excluding agriculture.
Yeah, so agriculture must be there too, right?
Yeah, so this is non-agriculture civilian population. So we exclude the military, and we exclude agriculture because agriculture is very seasonal. So it depends on when do you look at the ag people. But if you exclude those, most people are in the service industry, and many of those are in the personal and business services, and where you need. And so anyway, it's a complicated issue. Mm-hmm. We have time for final words from both of you, and then I will give a short list of our upcoming. We have a wonderful number of talks, one every week, and I will give a list of those. But let me now give final words, and we'll start again with you, Bob.
Thank you, Sebastian. Really, some very good questions have come in through Slido and that you've picked up, and I really appreciate the dialogue. I think that I just like to leave, again, maybe it is the optimist in me, but to really understand that there is going to be life after COVID-19, that this is not an existential threat to humankind, even in the developing world. I mean, we'll have 5% of people die, which is going to be horrible, tragic deaths that should not have ever happened, but it's not going to wipe out mankind. So I think that's something to be realizing at all times, that there are going to be people's...
Bob, sorry, Bob, let me interrupt. At least on my end, the connection sort of broke, and I didn't hear the number of people that you are predicting are going to die. And I only heard the 5, and I want to think that you're not saying 5%.
Yeah. So I think, as I was just going back again, that there is going to be life after COVID-19, that it's not existential threat to humankind. And basically notes, even if you did nothing, there'll be such tragic loss of life, but you could be 2, 3, 4, 5% of the world's population, especially in the developing world, will be most hard hit.
Even if you did nothing. Okay. Christine, last words from you, please.
I think 2 things. One is don't forget that the pandemic, we're living in parallel universe. Secondly is it's very hard time to be a leader, but we want to encourage leaders to practice good governance, and they're ultimately accountable. How they're going to be held accountable will be, we'll wait and see. And then the last thing is, my third point, it has a huge flushing out effect. All the things that we've been saying for such a long time, such as a robust public health system, how it's going to be financed, the role of the government. The government is there to do these things that can't be done by individuals or small groups. Can we have a good discussion about these issues? And it does require many countries to reform. I think a lot of people don't like to hear the word reform and pretend everything is okay, but everything is not okay.
And Christine, I think you've been one on this panel that's really emphasized the issue of leadership. And I'm thinking that because we have many students here from the Anderson School and from the School of Public Health, here is a great opportunity for students to look around the world, see what these different leaders are doing in different countries, see what it is and what are the qualities that make a leader, because they're going to be the next generation who are leading us. And so, look at what Tony Fauci is doing from the public health side. Look what New Zealand is doing, perhaps on the political leadership side, to really gain insights as to what can one do in their own lives to perhaps develop leadership qualities and see what that actually looks like.
Thank you so much, Bob. Very wise words to our students. So once again, thanks both to Christine and to Bob. Thanks to the 400 people who joined us at one point or another. I hope to see you all very soon. And be safe, wash your hands, stay at a social distance from everyone, and be hopeful. Thank you again for joining us.
Thank you, Sebastian, for monitoring this. It's been a pleasure. Bye all.
Thank you. Thank you very much.